The telehealth program at Intermountain Healthcare is really pretty broad and encompassing. It involves a number of different activities, including telecritical care, which is remote monitoring into our ICUs. It includes remote psychiatric consultation into some of our rural communities. Telestroke is a service where we have neurologists in our larger centers who can remotely come in with an audio-visual connection to the emergency department of other hospitals in the system to provide consultation for stroke patients that present to the emergency department. It involves neonatal consultation with neonatologists from our newborn intensive care units. So a number of different things that are all included under the telehealth umbrella. You can even expand it to think about education for our patients. Telehealth helps us accomplish our mission of helping people live the healthiest lives possible in a number of ways. One of those ways is remote monitoring. And we've been utilizing this with our home care agency, where we have technology monitors that monitor things like weight, blood pressure, pulse rate, oxygen level, and that data can be transmitted back to a site in home care where we have nurses that evaluate that, look for changes that would indicate we need to get out to the home and help make an intervention, or get with them on the telephone and make an intervention.
We are changing the way we get to provide care for our patients and really improving how they are treated, reducing costs, getting out into our communities in ways that we never have done before.
We're still in the homes, we're still talking to them, we're still part of their lives through home health care, but remote patient monitoring allows us to be even more effective than we would be if we were just doing the home visits. The tablet allows us to put on any kind of device that's relevant to the patient, so they're adding new devices to this all the time.
I think it's just knowing where you are every day, not a week later or 2 weeks later, or call a doctor and say, guess what? I put on 20 pounds, and this keeps you right there.
They know our nurses are monitoring the things that they are doing at home, and they're actually being more proactive about what they're doing in their homes, which we believe will help keep them out of our emergency departments and keep them healthy.
Frequently, as a caregiver, you don't know whether something is important or whether it isn't important. Having a backup there and having somebody you can call, or have somebody who's watching the vitals who can say, uh-oh, you're out of control, you need to take care of this, or you need to do that, means a whole lot.
We're able to provide access to specialists in their communities where they are today. And with the technology, we're now able to keep patients in their homes or in their communities where they wouldn't have been able to do so before.
Being proactive is really what we want to do. See the trends before they become an emergency and be able to deal with them right then.
The basic underlying goal is just aligns with our mission. It helps us to help people live the healthiest lives possible.